Community pharmacy's got a lot to offer. It's sort of on the high street, it's open access, people can walk in, there's always healthcare professionals there for advice.
As a practicing GP, I will be sending a lot of prescriptions their way and occasionally speaking to them about individual patients and some of the decision making behind those prescriptions.
We've talked about care on the high street, care closer to people's homes. I think that's ultimately where their strength lies, and working in a hub and spoke model around general practice and other forms of primary care is really going to be invaluable.
Community pharmacy is a front door to the NHS. We have been for a very long time. I think if anything has demonstrated that has been when we went through the COVID pandemic, we kept our doors open.
Community pharmacy are the heart of the community, and they're accessible, they're the healthcare clinicians on the high street who people can go to. So we need those networks to be built between colleagues in primary care, colleagues in secondary care, and build those networks up so that we can all share best practice.
In terms of healthcare, we have many challenges that not one individual, one sector can solve. It does require that pooling of risk and pooling of talent and expertise to come up with a workable solution.
We triage patients, we signpost patients, we carry out referrals, but now we're actually offering clinical services within the communities that we're serving.
I think the interface with other parts of the system is important. So at the moment there's a lot of attention on pharmacists helping GPs, sort of shifting a bit of the workload for minor conditions. I think that needs a lot of more conversation and work.
I think personally, we're on the cusp of a revolution in community pharmacy, not only because of pharmacy first, but also in 2 years' time we're going to have independent prescribers within community pharmacies. I think that will change the way patients use their community pharmacy.
We have some really good community pharmacy leadership, but there's not enough, and particularly there's not enough at neighbourhood level, which is this sort of population of 50,000 people where we sort of try and organise our services.
Where the relationships are good, they're very good, and they can definitely allow for much more responsive and effective care. So what we probably want to do, and I think is probably the most important thing about a network of community pharmacy leadership, is to level up those relationships, to make them into as strong as they possibly can be across the board.